Chairman, scheduling this very important hearing this morning. Last year, Republicans had a once-in-a-generation opportunity to work with Democrats to simplify our tax code and create a system that provides opportunities for the American middle class. Instead, Republicans wrote a law that gives 83% of the tax savings to the top 1%. Meanwhile, 86 million American families will see their tax bills increase. It's a great deal for the well-off, but a bad deal for most American families. It's no surprise that the middle class is left with a terrible deal. Bad process always leads to bad policy. Republicans rushed through their tax bill without the necessary review for a bill of this magnitude. This legislation affects 100% of our economy. It touches every business and every individual, yet there was not a single hearing nor a single witness. Remember, everyone lives in an economy. You cannot upend the revenue system of the country in 5 weeks without problems, and it's already clear with this legislation there are many problems. This was not tax reform. This was a tax cut for people at the top. The problem that Republicans hope Americans overlook is the law's devastating impact on your health care. In search of revenue to pay for corporate cuts, the GOP upended the health care system, causing 13 million Americans to lose their coverage. For others, health insurance premiums will spike by at least 10%, which translates to about $2,000 a year of extra costs per year for a family of 4. Just last week, we saw insurance companies in Virginia and Maryland ask for enormous price increases, and more companies in states across the country will do the same in weeks and months to come. These new health expenses will dwarf any tax cuts promised to American families. The majority of workers are not seeing their paychecks grow. Higher health insurance costs, coupled with rising prices for prescription drugs and gasoline, are straining family finances. The Republicans hope that no attention is paid to the impact of their tax plan on the national debt. The fiscal irresponsibility of their law is stunning. Over the next 10 years, they add $2.3 trillion to the nation's debt to finance tax cuts for people at the top. All borrowed money. Remember, this tax cut goes to the people at the top. And as we saw in 2001 and 2003, tax cuts don't pay for themselves. Working families eventually pay for them. When the bill comes due, Republicans intend to cut funding for programs like Medicare, Medicaid, and Social Security. Already, we've seen the Trump administration propose massive cuts to the Children's Health Initiative, which ensures our neediest children have access to health coverage and to Medicare, which provides superb health care to our nation's seniors. Mr. Chairman, when you began the process of tax reform, we wanted to be a part of it, understanding that trickle-down economics simply don't work, and that's what we are talking about today. If you didn't believe us then, I hope you believe us now. Since passage of the tax law, we have watched as record stock buybacks have really once again gone and created further concentrated wealth, as people indicated and suggested when the bill was first outlined. One American corporation even went as far as admitting openly that the tax law gave them the money to lay off U.S. workers. That's 5,000 families whose lives will be upended by this law. Democrats have always believed that instead of investing in people at the top solely, we should invest in the American worker. We know a strong America comes from a strong middle class, and there would be a better way to do true tax reform. We have a plan to improve health insurance affordability and put money in family wallets. We want to provide young people with high-quality education and ensure that workers have career training that they will need to succeed. It's also important that all Americans feel financially secure in their retirement years. We know that when people aren't worried about how they're going to afford their next meal, student loan payment, or medical emergency, they can focus on their families and their jobs and contribute to the growth and wealth of our nation. I thank the witnesses for being here today, and I look forward to a productive conversation. Thank you, Mr. Chairman.